Hi, my name's Tim Croft. I'm a proud Gurindji, Mulnyan and Muttra man. I'm the manager for Aboriginal Health in this health district. Just before we start, I'd like to acknowledge the traditional custodians of the lands we are today on, and also the lands where you might be watching this video. I'd like to acknowledge elders past and present. That's where our knowledge comes from, that's where our belonging comes from, that's where our identity comes from, and our country as well. And I want to acknowledge our elders who are emerging. Today we're talking about a pretty significant issue. It's a significant issue for all of Australia. It's about Close the Gap. Close the Gap is around acknowledging the very, very challenging outcomes we have in our lives as Aboriginal people. When we talk about Close the Gap, it's acknowledging now an Aboriginal child who's born will have a life expectancy difference of around 10 years, whether they're a male or a female. And those targets and the gap in that life expectancy has decreased a tiny bit, but not enough. The origins of Close the Gap are set around 2008, and they were initially led by government with minimal consultation with Aboriginal people. It's taken around 10 years for the government and what was called originally the Coalition of Australian Governments, or COAG, to recognise and acknowledge that they need to listen to the voices of Aboriginal people. So what we see in our Close the Gap agreement in the last 2 years, from 2020, is there's now a shared agreement. There's now an acknowledgement that an Aboriginal voice and shared targets are really important. So if we're talking about a vision in Close the Gap, the vision is, and the aims of Close the Gap are, let's talk about health and life expectancy, is to see the life expectancy gap gone in a generation. The time frame they've given that, they've actually now consulted with Aboriginal people. And I'll talk about that a little bit more in a moment, but that target is 2031. So the vision is to change these outcomes for our lives. In my role as Manager for Aboriginal Health for the district, and I think all of our Aboriginal health programs in our district, we're acknowledging the challenges in health, and we're asking all non-Aboriginal people to come on board on this day, Close the Gap, to have a look at what you can do in your services to make an impact. Outside of what our health organisation can do, Close the Gap also considers all the other determinants in our lives, and they're pretty significant, and the challenges there are obvious and the impacts are quite profound. I'll touch on those few things in a moment, but I'll just go back to the government and meeting now with what we call the peak organisations, the peak Aboriginal organisations like NACCHO, the National Aboriginal Community Controlled Health Organisation, meeting with other peak Aboriginal organisations to hear that voice, which for years said, hey, you need to talk with us, nothing about us without us. And so now there's been, sorry to use this word, consultation. What does that mean? There's been a lot of talk. So Aboriginal people want to have the talk, but they also want to see the action. So in our Close the Gap framework now, there's, as I said before, there's shared decision making. There's an acknowledgement that you really need to build the strength of the Aboriginal community controlled sector, and that's really around health, but there are other important organisations in there as well. We work in a government health organisation, and there's been, I think in my time in this district, so that's 5 years, there's been a change. It is slow, but it is important and good to see that there's an acknowledgement of all the differences in government organisations and the way Aboriginal people might either choose to trust them or be very, very slow to trust or not trust at all. And so it highlights the need for our services to acknowledge those barriers and how we access or see Aboriginal people access services. And it's also around acknowledging really challenging things, and I'll bring in the R word, racism. So our district is acknowledged, that there's differences for Aboriginal people and there's differences for people from other cultural groups. And those experiences of racism, whether it's the community experiencing it or staff, they can have profound impacts on the way people access services or trust services. So that is an important foundational part of Close the Gap. There are other parts of Close the Gap framework, which I won't talk about too much today, but it's also leading or letting Aboriginal people lead knowledge and awareness of their own data. You know, sometimes that data research is always controlled by white mob researchers, and you know, more and more Aboriginal people are coming into that space and saying that's our knowledge, that's our stories. That's a broad framework. We're just talking about Close the Gap. There's so many new targets within Close the Gap. So once again, we talk about wanting to close the life expectancy gap. There's really important comments in the Close the Gap framework about the importance of childhood and early learning. There's important targets around housing and employment. But more significantly, I think there's acknowledgement of the importance of culture, connection to country, and a strong identity. There's acknowledgement of the incredibly, difficult area of our overrepresentation in the criminal justice system and also in child removal. So the profound impacts that they have are significant, and the acknowledgement of those factors, or what we might call determinants, the upstream sort of impact on our health and our life outcomes, can't be underestimated or under-talked about. So there's this whole range of things within the Close the Gap framework now which acknowledge our history, which acknowledge our determinants of why Aboriginal people have a shorter life expectancy.
So I'm Carleen Dumbrell. I'm the Occupational Therapy Advisor in South Eastern Sydney, and I'm the Department Head here for Occupational Therapy at Sutherland Hospital. So I'm really excited by the new shirts that we're wearing here at Sutherland Hospital. It's given me a great opportunity to talk to staff and patients and carers. And also I get stopped at the shops and people say, "Where do you work?" And it's just been really lovely to have conversations with people. And I feel like I'm promoting Sutherland Hospital as a place that respects Aboriginal culture and gives a sense of welcome to people from Aboriginal culture. It also gives staff an opportunity to ask questions, and I think what I've learned is to definitely ask people that you work with lots of questions so you can learn more, and spend a lot of time listening. Really slow down and listen to people so I can keep learning about what difference I can make and how I can maybe make a difference and work with my colleagues to close the gap. So I think I have opportunities to close the gap in the work that I do when we are developing a new model of care. So when funding comes along, which sometimes it does, we really need to do that in partnership. We need to co-design the service so that it meets people's healthcare needs, and that's why we're here. So if we can create a new model of care and meet people where they want to access healthcare, then I think that's going to help with closing the gap.
Hi, my name is Tracy and I work in Aboriginal chronic care. Our program is aimed at Aboriginal and Torres Strait Islander people with a diagnosed chronic illness. Our program is aimed at closing the gap, and I feel it is important to create trusted pathways in the health system, and I feel honoured to be able to support my mob.
Hi, I'm Evan Freeman. I'm the Equity Coordinator for South East Sydney Local Health District. I've been in the role for a few years now, and part of that role is working with Aboriginal health wherever I can. Today's talk is really about Close the Gap. So Close the Gap is something special to me because I've been working across Aboriginal health in different areas for some years, and it's a real opportunity for me to try and help raise the profile of Close the Gap as an important part of health in particular for Aboriginal people. Because when we look at Close the Gap, we often see the deficits, and that's what it's been focused on quite a lot, when we don't always take the opportunity to see what that deficit really means. An important part for me is that we don't really look closely enough at our own deficit as the dominant culture. It's our deficit in knowledge of Aboriginal history and Aboriginal culture. And this is where we need to focus some of this day to really help us as a really important part of health infrastructure to make sure that we get it right.
Hi, my name's Lauren Phillips. I work in the Bulbul Healthy Lifestyles Aboriginal program. The aim of our program is to provide a safe place for Aboriginal and Torres Strait Islander people to come and get some information about exercise, healthy eating, safe use of medication, diabetes management. We offer an eye clinic, hearing clinic. We do lots of stuff here. It's a nice friendly way to get involved in health.
I'm Ben, I'm the social work department head at Sutherland Hospital. So we have social workers across the hospital from emergency departments through to the wards and also sometimes for pre-admission as well. Our social workers are really keen to play their part in closing the gap. We're very strong advocates. We love to see people have access to the care and support that they need and in the right way as well. And we're also very strong listeners as well. Another important aspect of closing the gap in Aboriginal health is to make sure that we're asking the question, well, do people identify as Aboriginal or Torres Strait Islander? And that's really important, sets the baseline for access to services, helps us to make sure that we're providing the right services in the community, and helps us to be responsive to needs as well.
Hi, my name's Nicole. I'm the exercise physiologist for the Bulbul Healthy Lifestyle program. The program is basically working at preventative health for Aboriginal and Torres Strait Islanders within the Sutherland Shire. We look at lifestyle factors such as diet and exercise, but also the importance of connection to culture and community and how that is a foundational and important part of health for the Aboriginal and Torres Strait Islander community. My role within the program is to develop individually and culturally appropriate exercise intervention and therapy for Aboriginal and Torres Strait Islander peoples. So it's really important to develop a therapeutic relationship there built on mutual respect and understanding, where we're both open and empowering the individual to make their best choices for their better health outcomes.
So hi, I'm Mel. I'm one of the Aboriginal health workers with Narangba Eyes. We're a child and family health service. We work up at Menai and we work with families from 0 to 5 across St George and Sutherland Shire. The main aim of our program is to send the kids off to school with the best possible start. And I suppose you could talk about that as closing the gap between the Aboriginal kids and the non-Aboriginal kids when they start school. There's lots of evidence to show that early intervention really helps with doing that. And the monitoring of child development, putting in place things like occupational therapy and speech therapy really early on really helps with that sort of thing. And I think our transition to school program that we run really winds that up really, really well. Yeah, so my vision for closing the gap is that Aboriginal culture is celebrated in all of Australia, cultural events, in schools and in healthcare, and that people really embrace and understand Aboriginal culture.
My vision for closing the gap would be all Aboriginal and Torres Strait Islander people feel they can walk into a hospital and feel comfortable and safe.
So for me, I'd like to really see Close the Gap as a day that we take a pause and say, well, Aboriginal people have done such a great job at surviving and rebuilding culture over the last 200 years and really take some heart in that and try to show people that we are willing to take the time to learn a bit more about culture, a bit more about history, and put that into practice every day, particularly for clinicians, making our health space something that's safe for Aboriginal people to come to.
My vision for closing the gap would be that there is no gap. And I know that's a long-term goal, but that's my vision.
We all have a role to play in closing the gap in Aboriginal health, and that might be something simple. So it could be clinicians spending the time to talk and listen, really listen to Aboriginal people, their families, and really understand what's happening for them, and really then to take action on that as well. Not only to tailor our health services, but to make some tough decisions in terms of investing or reinvesting in different areas and adapting our services for what we need in our community.
My vision for closing the gap is that eventually there will be no gap, and that we can work together to come to a better health outcome for everyone involved.
My vision for closing the gap long term is to see these children down the track when they're adults with less risk of chronic disease, because they've had a really happy, well-rounded life, great education, and engaging meaningfully in society.
Within our district, I think it's important that people take steps to share a vision, to walk alongside Aboriginal people on this journey, and also obviously our Aboriginal staff who are working in these spaces, and acknowledge the challenge of history, the challenge of intergenerational trauma. That also has profound impacts on our health. So just in finishing, I once again just invite all of our staff in the Health District just to share in this vision and to share in these steps on our journey. Mandach, my word for see you soon.